everyone. It is Dr. Richardson, and I am back with Chapter 17. Chapter 17 will cover physical development in late adulthood. As always, please make sure that you read your textbook, as the lecture is supplemental to your reading throughout the week. If you have any questions about the content in this PowerPoint or content within the textbook, or if you have any questions in general, please do not hesitate to reach out to me. So let's get started. So chapter outline, this chapter will cover, again, late adulthood. We talk about longevity, the course of physical development in late adulthood, and health. So longevity is the life expectancy and lifespan, the young old and the oldest old. And there are biological theories related to aging. So lifespan is the maximum number of years an individual can live, approximately 120 to 125 years. Life expectancy is the number of years the average person born in a particular year will probably live. This is improved with advances in medicine, nutrition, exercise, and lifestyle, along with substantial reduction in infant deaths. So the average life expectancy for those born in 2019 in the United States is 78.8 years, but decreased to 77.8 years in 2020 as a result of COVID-19. So compared to other countries around the world, life expectancy in the United States is higher than some and lower than others. Within the United States, life expectancy also differs for various ethnic groups and for women and men. So in 2019, the overall life expectancy of US women was around 81.4 years of age, while for men it was 76.3 years of age. So that's kind of a big gap there, about maybe 4 or 5 years. This is due to health attitudes, habits, lifestyles, and occupation, which probably make a difference when it comes to life expectancy within men and women. All right, and so in Okinawa, which is in the East China Sea, individuals live longer than anywhere else in the world. This is possibly due to diet, low stress lifestyle, caring community, activity, and spirituality. Here we also have a chart here, and it talks about the risk of dying from different forms of cancer, which is lower in Okinawa than the United States and Japan. So these individuals from this nation, they eat lots of tofu and soy products, which are rich in substances that are believed to be lower, which lowers the risk of breast and prostate cancer. They also consume large amounts of fish, which reduces the risk of breast cancer. So here we have that chart here of cancer deaths within these different countries. So the young old and the oldest old. So young old is considered between the age of 65 and 84, and then the oldest old is those age 85 or more. In terms of functional age, maybe more biologically and psychologically fit than a 65-year-old, mostly women, widowed, and live alone. A significant number have cognitive impairments, but many do not. So then we talk about biological aging, which begins at birth, evolutionary theory of aging. This theory talks about natural selection, which has not eliminated many harmful conditions and non-adaptive characteristics in older adults. And then criticisms of evolutionary theory. Evolution occurs on a time scale that does not lend itself to empirical study. It fails to account for cultural influences. So with many theories, you will see that there are criticisms of certain theories, and there have been counter theories that suggest different beliefs. It's up to an individual on which theory they identify with, or which theory that they may believe when it comes to different theories. All right, so again, there are biological theories of aging, and then the course of physical development in late adulthood, the aging of the brain, sleep patterns, sensory development, physical appearance and movement, the circulatory and respiratory system, and sexuality. These are all important when it comes to aging. And then the aging of the brain, again, shrinking, slowing of the brain. The brain loses 5 to 10% of its weight between ages 20 and 90. And then the prefrontal cortex shrinks the most with aging. We also talk about sleep. Again, the National Sleep Foundation represents older adults get 7 to 8 hours of sleep. Many older adults have difficulty sleeping and their sleep is more easily disrupted. Strategies include avoiding caffeine, over the counter sleep remedies, staying physical and mentally active, and limiting naps. Physical appearance and movement. The most noticeable changes are wrinkles and age spots. Weight drops after age 60, with most adults experiencing muscle loss. Sensory development, vision starts to decline in late adulthood, is linked to cognitive decline, fewer social contacts, and less challenging social/leisure activity. Okay, and then we have also hearing. Hearing impairments become a serious issue during the late development, late adult development. You may see hearing aids and cochlear implants, which minimize problems linked to hearing loss. These sensory losses begin at around age 60. Here we have some statistics here related to vision and hearing. 65 to 74 years old, there's a loss of acuity even with corrective lenses. And then hearing, there's a significant loss of hearing at high frequency and some loss at middle frequencies. Touch and pain. With aging, many individuals experience impaired touch, detecting touch less, and lower extremities. An estimated 60 to 70% of older adults report at least some persistent pain and more frequent back pain. Older adults are less sensitive to pain than younger adults, and this decreased sensitivity can mask injuries and illness. Cardiovascular disorders increase in late adulthood. High blood pressure is more common in men than in women and has been linked to illness, obesity, anxiety, stiffening of blood vessels, and lack of exercise. And then lung capacity drops by 40% between the ages of 20 and 80. Sexuality can be lifelong, but aging does induce some changes in human sexual performance. With age, orgasm becomes less frequent in males. Many are sexually active as long as they are healthy, and there are therapies that have been effective in improving sexual functioning. Health problems are significant during late adulthood and they require attention and understanding. Substance use and abuse can also have implications and challenges for older adults. Of course, exercise, nutrition, and weight management play critical roles in maintaining health during late adulthood. And then health treatment approaches may need to be tailored to address specific needs of older individuals. There are chronic diseases and conditions with slow onset and long duration, which are very common in late adulthood. These conditions include health conditions, diabetes, asthma, and arthritis. Low incomes are strongly related to health problems. Causes of death in older adults is in 2019, heart disease continued to be the main cause of death in the US for adults age 65 or older, followed by cancer. And then in the US, adults age 85 and older, heart disease was an even greater cause of death than cancer. Ethnicity is linked with death rates of older adults. So heart disease was the main cause of death in non-Latino whites, Black Americans, and Native Americans, followed by cancer. And then cancer was the main cause of death in Latinos and Asian Americans, followed by heart disease. So again, health problems can include inflammation of the joints, and then intensive loss of bone tissue, which may cause adults to walk with a stick. And then women are more vulnerable, and accidents are the eighth leading cause of death in older adults. Falls are the leading cause of injury deaths for adults age 65 and older. Substance use, multiple medications increase the risk associated with consuming alcohol and other drugs. Late onset alcoholism is used to describe the onset of alcoholism after the age of 65. Moderate drinking of red wine may be linked to better health and increased longevity due to the benefits of resveratrol. And then exercise is an excellent way to maintain health and live longer. Research has revealed that exercise is linked to increased longevity, is related to prevention of common chronic diseases, is associated with increased effectiveness of treatment for many diseases, improves older adult cellular functioning, reduces the likelihood that adults will develop mental health problems, and can be effective in their treatment, and is also linked to improved brain, cognitive, and affective functioning. So, four aspects of nutrition are especially important to older adults, which include getting adequate nutrition, avoiding overweight and obesity, deciding whether to restrict calorie intake, and determining whether to take vitamin supplements. Over 42% of older adults in the United States are obese. Until recently, most experts on aging and health argue that a balanced diet with all that was needed for successful aging. There has been some proposals, however, that certain vitamin supplements might help slow the aging process and improve the health of older adults. As older adults live longer, disease management programs will need to be expanded. Currently, older adults with health problems in the U.S. receive the recommended medical care only half of the time. Factors related to health and survival in nursing homes are the patient feelings of control and self-determination. And that completes chapter 7. Again, if you have any questions related to the content, please do not hesitate to reach out to me. And I hope everyone has a great week.